Learners sometimes struggle. It's a tough reality in any educational environment. But how do you approach a struggling learner? If you're like me, you've probably wondered, where do I begin? What do I say? What if it doesn't go well? But approaching the struggling learner is a key skill for any educator. Hi, I'm Amy Gardner, Associate Dean for Faculty Development and Director of the Academy of Medical Educators here at the University of Colorado School of Medicine. Hear from award-winning medical educator, Dr. Mel Anderson, on his tips for approaching the struggling learner and strategies for successfully getting them back on track on their learning journey.
As educators, we at times encounter learners who are not fully meeting the expectations we or their training programs may have. These learners may require closer supervision, require more of our time, or require us to tap into specific teaching skills. And in truth, this can be frustrating for all involved, but it doesn't have to be. Hi, I'm Mel Anderson, Professor of Hospital Medicine and Clinician Educator at the University of Colorado School of Medicine. In the next few minutes, I'll review two overarching strategies I and others have developed over the years that can assist you in helping struggling learners get back on track and in a way that will be beneficial for both you and your learners. The first strategy is to promote a lifelong learning framework for yourself and your learners. For the entire team, but especially for struggling learners, it can be profoundly impactful to create a learning environment where you explicitly say that each of us is a work in progress, that we are here to learn and grow as much as we can, and that growth is effortful but richly rewarding. This framework normalizes that effort, implying that everyone has areas for growth and that everyone needs feedback and dialogue to realize that growth. Talking about a growth mindset also buttresses your trustworthiness as an educator, that you have humility and are open to change. You can share how you may have struggled or exhibited agency over your own professional development, which role models authenticity. Creating a lifelong learning framework can help all learners, especially those who may struggle, feel more empowered and accountable for their own professional development. The second strategy is to develop a structured, partnered approach with your learner. Not unlike how we interact with patients, we need a consistent and structured way to help struggling learners. Most likely, you'll have an initial subjective sense that something is not quite right. But you must go further to gather and document objective data to better define the core issues. And this is where having a framework for identifying the domains across which learners may struggle can be helpful, guiding what additional information you may seek and how to talk about it with your learners. Dr. Jeanette Gerasio developed the Competencies Plus model. This model expands on the 6 core ACGME competencies in 2 important ways. First, she divided the patient care competency into 3 sub-competencies: clinical skills, such as gathering history and physical; clinical reasoning, making sense out of that information; and organization, the ability to operationalize those plans within a healthcare system. Second, Dr. Gerasio adds the very important cross-cutting domain of wellness, which, when lacking, can have broad negative impacts across multiple domains of performance. Sources of additional information include direct observation of clinical activities, asking about interactions with faculty or staff, and asking about prior clinical rotations. It's critical to involve the learner as early as possible in defining the domains that need focused work and in developing plans to address them together. Outside of these 2 strategies, there are other important observations I'd like to share with you. Unfortunately, learners often struggle in more than one domain. It's important to loop in program leadership early if you have concerns. They may have knowledge of prior struggles and resources to help their trainees. Ensure that you ask learners how they think they're doing, what things they're working on, and gauge their level of insight into their own performance. Avoid the temptation to conclude that the underlying deficit is deficient medical knowledge. Often there are issues with applying that medical knowledge through clinical reasoning or difficulty communicating about that knowledge, especially in a group setting. This is where asking narrower, fact-based questions or, outside of rounds, about prior assessments of medical knowledge, like in-training exams, can advance your understanding to better identify the domains your learner needs to improve. And lastly, becoming more proficient working with struggling learners carries over into the assessment of non-struggling learners. As the domains of effort are the same, your assessment and feedback will be enriched by doing both. With these strategies, I hope you can better pinpoint underlying issues and partner with your learners to create a targeted improvement plan. As much as managing learners in difficulty can be challenging and even uncomfortable, this is where you as an educator can potentially have your greatest impact, promoting a culture of lifelong learning, accountability, and empowerment. Thank you.